And welcome to this meeting of the Safeguarding and Special Educational Needs Subcommittee. Please note that this meeting is being live streamed and the recording of the public section of the meeting shall be uploaded to the City Corporation's website for up to 1 civic year. Chair.
Morning, everybody. Perfectly formed meeting, although only three members today. So I'm sure we're going to have a really engaging, exciting discussion on every topic. I wasn't paying attention properly. Did you do members of declaration? No,
We're at item 1, apologies. So apologies have been received from Deputy Anne Corbett, Deputy Kerry Wilkins and Sushil Shaluja. At item 2, we have members' declarations. So I'm going to ask if any members in the room have any declarations in respect to items on the agenda, please. Seeing none, we turn to item 3, which are the minutes, and these are to agree the public minutes and non-public summary of the previous meeting held on the 1st of July 2025.
Steve, I think this falls to you and I, because I think Stu wasn't here. No. So there's only you and I that can say that they're accurate, I think. Yeah. Okay. So happy to approve.
Thank you.
Thank you.
Those are approved. So we turn to our first substantial item of business, which is the Independent Reviewing Officer Annual Report for 2023 to 2024. This is an information item starting on the main report can be found from page 21 in the main agenda pack. And this has a non-public appendix, which can be found in the non-public appendix pack from page 3.
Okay, and Ria, yeah, you're going to talk to this one.
Good morning. Reporting on 2024 to 2025. The headlines from that year were we had 22 children in care for the whole year. Over that period of time, 15 were new arrivals into care. The City of London is very unique because all of our children in care that year were male. A large proportion are of the upper end of the teenage years, and the majority of our in-care children were unaccompanied asylum-seeking children. There has been a shift in their countries of origin, which we're doing some further work to explore why that is in this current reporting year. So we're seeing new countries such as Chad, Turkey and Sierra Leone. The National Transfer Scheme has had a big impact on the type of work and the nature of our work. The average period of care for our 13 children that were on the National Transfer Scheme, the average period of time that they're in our care is now 33 days. So the social work team have had to become very responsive and very quick in terms of the services that these children are given. And the social work team have risen admirably to this alongside the health teams as well and the education team. So we're looking at, in terms of the longer term looked after children, there's been some really strong care plans, very creative and responsive social work. We've had a new contract with Quorum, who now provide the annual survey and our advocacy and independent visitor service, and that's been going well. We're maintaining the improved initial health assessment timescales. We've got good communication with the health service, and the priorities going forward is to look at some of our care plan work and just tighten things up to make it more responsive for the children in our care, and some video work for our asylum seeking children to help communicate with them better.
Fine, thanks, Ria. Just to remind members that Steve and I last time might remember that we ran out of time on our agenda last time to do justice to this report, hence it's come back, and possibly there's more to be said in the non-public agenda rather than public, but if Stuart or Steve have got comments they want to make in public, we'll take them now.
Yeah, well, thanks, Joe. Well, I was probably going to ask that question because it is very confusing when we've got a public report. But then maybe because we're dealing with such small numbers, it is difficult to understand about what we should be asking in the public sector section, I should say, of the agenda. But should I try to ask a couple of public questions?
You can try, and if it's going
Kate will tell me if so I suppose what I'm interested in is the asylum seeking children. How did they end up in the city? I know now that the National Transfer Scheme means they're not with us very long, but how did they end up here? Perhaps you could say something about that. And it's quite difficult for me because I'm sort of when I was reading your reports, I was getting into my my professional role rather than my member role. But I suppose I'm interested about age determination, what process you're using for age determination.
Yeah, sure. So in terms of how a lot of our unaccompanied asylum seeking children approach the city, it's mostly at Bishopgate police station. So Liverpool Street the Liverpool Street station seems to be a big hub. So if they've made it across the channel, they'll often be taken to Liverpool Street. We're not sure about the mechanics of it, but we are looking into it. Laura's actually starting a piece of work with the police this week, in fact, because we are, we've seen signs that there is an organisation element to things that we just would like to explore a bit more. There's patterns that we're just interested in exploring, but Bishopsgate Police Station is our main point of entry.
Perhaps we could hear a little bit more in non-public about that last comment you've just made.
Yeah, sure.
Yeah.
I'll let Laura speak to that because you've set that up with the police this week, isn't it? In terms of age assessments, maybe Rachel might be able to speak more to that because that line of work tends to take place mostly before I then become involved as the IRO.
Yeah, so I'm Rachel Talmage, I'm Head of Children's Social Care and Early Help. Age assessment, we're all, most of the staff are fully trained in age assessments. We use this short form age assessments we've learned from case law, etc., and practice guidance from LDEX across London. And we do that. It's hard to tell. It's notoriously hard to tell, but we follow best guidance on it, and we do. If somebody is very obviously older than stated, we will walk out, but with a letter explaining why, following judgments, so that we will not be legally challenged on that. We also age assess in a full way where we think it is likely. So if, for example, a common example is where somebody's saying they're 14, 15 and I wouldn't be comfortable having them in a school, or with other younger children. We think of safeguarding first when we're placing, and then we age assess there. So we do age assess, yes, but it's notoriously difficult, but we make sure we're part of the London Asylum Seeking Consortium and take part in the regular trainings. If anybody is walked out, which does happen occasionally, then I need to be there as a head of service too, because it's quite a significant decision alongside the social work practitioners.
Stu.
I'll try to remain as in the member question, but I suppose so what I'm interested in then, I suppose, is what ages young people are saying they are, because obviously if they're saying they're 14 and they're a little bit older, then that's sort of okay. But if a lot of young people are saying they're 17, that's going to be quite difficult for you to understand.
That's right, and you can't tell. So nobody can really tell the difference between a 17-year-old and a 20-year-old. You just can't do that. And you have to go on the side of welfare and caution, but then safety plan and risk assess as you go. And if anything changes over time, then you can assess then and say, actually, this has come to light. We did actually, I'll say that for private, sorry. But yes, you're right. But we do age assess where we can, but with the best will in the world, you cannot tell the difference between a 17-year-old and a 19-year-old, but you can tell the difference between a 17-year-old and a 30-year-old, or you can at least try. And what sometimes we do, in line with the guidance, in line with judgments, etc., is, for example, if we're worried about somebody being 14, 15, when we're not happy, we might re-age assess to 17, for example, and they're not in a setting where there's children under 16 in a school setting, but then you risk assess as you go. But we use the guidance, we use the training, and we make sure there's 2 social workers, and it's about risk really in the right service. It's tough.
Keep going.
Yes. One last point to that, and of course, and you've raised this, of course, because one of the big issues is what risk they might be presented to other people if we place them in a setting where they are actually a lot older than we've assessed them as. But I think you've sort of answered that, but I think it's important that we as members continue to challenge officers to make sure that, as far as you know and we know, that the safeguarding of others is being properly regarded.
Yes, absolutely. So it's a risk to others. It's also the risk to the young person themselves, having been potentially trafficked across the globe, and them as a child, and onward trafficking. So we use Operation Inurst, which aims to prevent onward trafficking of our children across the UK, which happens obviously. But yes, we're mindful of risk. When somebody's in front of us, we don't know anything about history or not. We don't know about risk or resource for them. We don't know what the risk or resource is to them as a child or young person either, or as a grown person. So the way we start in our service is compassion. You've got somebody in front of you, if they're older than they say they are, well, it's actually about how do you meet that person's need at the time, basic needs, clothing, housing, etc. And they'll be supported to go to adult services, not adult social care, sorry, adult immigration. But we're mindful of risk because we don't know anything about the person in front of us, or in fact what's spoken about. So risk to and risk from, absolutely. It's not easy.
Yeah.
I note from the report that you had 5 children in care in March. How many do we have today?
As we've had quite a lot of movement actually. So we've had, is it 7 in the last, we've had 7 children come into care in the last 3 weeks, but then a lot of them have then moved very, very quickly. So as it stands today, but there has been movement on Friday, in fact. So, and as it stands, it was 12 on Thursday, but then we've had a couple of movement, haven't we? So I think it's about 10. Yeah.
What actually happens to them when you say movement? They move outside of them.
It's the National Transfer Scheme. So it is normally always further up north. So it's places like Scotland, Manchester, Yorkshire, Leeds, a lot of up north places, but we don't decide that. The National Transfer Scheme, which is in conjunction with the Home Office, they make that decision and they'll say this is where this child has been allocated, and then within that time it's probably about a week, isn't it, that they'll be, if they're allocated within a week, they've been moved.
I would say that it used to be a very ineffective system. It's now more effective because it's mandatory, and also there's a cash incentive for local authorities receiving, which has really changed the entire process for young people and us. Yeah.
Incentive. Can I just ask a couple of questions on the table on page 23? It's the action column, I guess. So on the first objective, completion date set for reporting year 25-26. Just, you know, when is specifically is that going to be reported, so that we're pinning down the dates and don't move. And then the next one down, it's ensuring that service providers, etc., consistent with anti-racist policy. How do we know? How do we get feel for that? And the more general question is, when our services were inspected, which Safeguarding Send is not very long ago, did the inspectors make any comments on any of this area of work?
On specifically the IRO work? Yeah, sure. So in terms of the table, I think it's showing up as page 24. There's not a table on page 23 on my.
It's proposed.
Okay, sorry. So for is this the planned and recommended improvements for 25?
Proposals, yeah,
26?
Following areas for improvement.
Yeah, sure. So in terms of the specific date for completion of those things, they've had to be left kind of open just because we're working with other teams. So it's not just dependent on me planning the work. So there's some of the work that we're doing with the Mosaic team around the care plan, and obviously at different times other services have to have more of a focus. So when we've had like the SEND inspection or the adults work, in the specific thing around the care plan though, we are extremely close to completing. So I would say within the month, we just need to do some review and then we're ready to go live on that. And then the making the review process more inclusive. Again, that was we were working with other departments. So we had the communications team looking into various resources and how much it would cost to commission different video projects. So that takes time, and we're dependent on their timescale for that. So again, we've just had some news about what service we can use. So then we can be a bit more specific at this point, and would hope to have some completed videos within, I would say, 3 months.
I think the question is, though, how do we know that it's bringing the desired effect or the desired impact? You know, how do we know whether providers are consistently anti-racist, for example?
Yeah, I think that is that's always going to be a hard thing to measure in a data way. I think it's feedback, it's things like the annual survey. That is a question that's talked about when they meet with the children and the families. When I have supervision, for instance, we will always bring that up as a supervision discussion. So I will report back on the feedback that I'm getting when I'm meeting young people. So I think it's something that you would find it hard to qualify in a figure. But I think just from talking to our users and making sure that we're reporting on it in things like the Action for Children survey. So for instance, at the moment, we're aware that there is a lot of social unrest around asylum seekers, around the use of hotels. So we understand that that could cause increased risk for our cohort of looked after children. So we will discuss that in say the quarterly care leaver and looked after children meetings that Rachel chairs, and in that we'll share information about where these hotels are. We'll ask the social workers to share that information with our young people. So the work is being done, it's being discussed, it's reported on, it's recorded, but it's not in a data figure way, if that makes sense.
Yeah, no, it doesn't have to be numeric feedback. I guess it's understanding the system and taking the the more general feedback that we have.
And just to add to that in our commissioning reviews with all our providers, that's something that we speak about in there in terms of actually what is their understanding, what's their training of staff, what's their support offer to our young people. So that's another method where we're testing in conversation with our providers.
Okay, thank you. Any other?
If I may, Helen, if I could just come in on the last point, you asked a question about inspection, and maybe to spare Ria's own blushes. It was a very positive feedback that came, and actually the reviewing service was a focal point of interest for inspectors in oversight and how we're supporting children with additional needs, SEND support, and hopefully that will be reflected in the published report that's going to come out in the next couple of weeks. But very positive feedback.
Great, well done, Ria. Thank you. Thanks very much. Okay, well, we can come back to any other points of detail in non-public should we need to. So should we move on?
Thank you, Chair. So we move on to the City of London, item 5, which is the City of London DCCS City of London 2025 annual survey. And this is starting from page 25 of the main agenda pack and the public appendices pack from page 3.
Laura, I think this is you.
Thank you. So in terms of our annual survey, we had a 51.2% completion rate, which relates to 32 individual children. There were 26 individuals who didn't respond to calls made, and there were 10 individuals who declined to take part in the survey. Everybody received at least 5 calls on different days and times to try and make sure we could be flexible to people, to give them the opportunity to give their feedback. We recognise that the length of the care leaver survey in particular is quite long, and so we'd worked with care leavers who agreed that all the questions were relevant, but we also gave an option to complete a shorter survey to our care leavers, and that was taken up by 11 young people. And again, so just demonstrating our methods to try and diversify how we can get feedback in the most meaningful and constructive way from all our young people and families. So the majority of the feedback across all the service areas was very positive, and particularly noting the accessibility of our social workers. And across the system, there was a good understanding of the plans in place, and the majority felt that they had the appropriate support that they needed. All children in care and care leavers reported that they felt they had a safe person in their lives to speak to if they were worried about anything, which is really positive. Care leavers remain our largest cohort that we survey, and we do continue to see themes of loss and isolation in that group, which is not surprising given their journey, etc. This year, all callers had been provided with a range of support services. So when they were speaking to individuals, if they were concerned, they were able to signpost them to a range of services. They also, where individuals raised specific concerns, asked whether they wanted those to be fed directly into the service. So we could take action, because obviously it's an anonymous survey. So if someone says they want to see their social worker more or something, we'd like to address that. But actually nobody took up the option to have that information shared in that way. So also in our care leaver cohort, several felt that they had barriers to accessing education, training and employment, a lot of that stemming from having limited English or English as a second language. However, there's a whole range of supports, particularly through the virtual school and elsewhere, that does support our young people to improve their English skills. Where young people described unhappiness with their home environment, this is mainly due to wanting a permanent tenancy. That's a big main kind of concern with our young people, and we are working with housing. We do regular online sessions with housing, so young people can be informed about where they're at on the waiting lists and ask any questions. And we're also just starting to develop a programme of work with housing about how we support young people and upskill them to manage a tenancy before they get into that position. That's a piece of work that will be ongoing this year. All the feedback we receive is fed into our service development plans and action taken to address any issues raised in the You Said We Did document that accompanied this report. In terms of health and well-being, that's an area where young people consistently report that they are clear what health services are available to them and that they feel confident and able to ask to access those services. And we're doing particularly well around dentistry, and that's based on lots of work over the last couple of years about ensuring that our young people are able to register with dentists and get appointments, etc. But yes, that's my update. So any questions or comments?
Stuart?
Thank you, Rachel. It was interesting. Just wanted to ask, is there any face-to-face interviews, or is it only through phone calls, which I would think might be easy to avoid?
So at the moment it's phone calls, but that's something we've started discussing for next year about the offer that could be made to have face-to-face interviews. So at the moment, so the majority of our young people do communicate a lot through WhatsApp. That's a good one. But so we send letters, we send emails, and then it's phone calls. And as I said, this year we did have an online survey if people wanted to do that. But yeah, we are looking for future to offer additional ways of giving feedback.
Steve?
Thanks, Laura. Can you say a bit more about what you're doing with housing and what results we're getting?
Yeah, so I think the online sessions with housing have been really popular. I think young people obviously feel the wait times are very long, and sometimes they forget which areas they've selected, or as I said, want to know very much where they are on the list and how quickly the list is moving. Obviously that's quite a difficult one to you don't know when someone's going to move out, but I think just having those spaces and them knowing that they can ask questions directly of housing as well has been really positive for our young people. That's always a very well attended session. Rachel attends that session as well, so again kind of been opening up that communication. And as well, it takes a bit of pressure off the social workers that they're not the only one giving that message, because sometimes that can get quite hard, and young people might feel that's a block. Obviously housing is a finite resource at the moment, but working with housing about how we communicate messages and expectations from the moment young people arrive. It always gets very difficult in terms of what's happening in other London boroughs as well. You'll often hear, oh, so-and-so got a flat at 18 if they live there. But, you know, so trying to do a lot of debunking myths around housing and expectations. And yeah, as I said, we've started some work around tenancy support, about how we can, I suppose, help young people feel that they're progressing on a path towards their permanent housing, and giving them some additional support, so when they do get that permanent housing and they've got their tenancy, they're in the best position possible to manage that positively.
Okay, but you haven't said about what outcomes. How many young people have we managed to secure tenancies for? Where are those tenancies? Do you have to say something about what we've done the last couple of years about that?
Help you out?
I can help you out. What I can say is that all of our young people have got tenancies by the time they're 25 in the city estates across, whether it's in the square mile or out, and we don't see a reason for that changing, and that's not too bad actually. Although if you're 18, a year is a very long time. If you're my age, a year goes by in a second. So it's it's much ado about managing that kind of that time frame. There's also been some housing estate. There's a housing estate that's going to be coming on board at some point to provide extra housing. I think there's been legal challenges with that, so that's hopefully going to one day or not. I've been saying this for a while. Yeah, so hopefully that will speed things up. But I think it's safe to say that all of ours by 25. I'd be surprised if we didn't have anybody in their tenancy, which is no bad thing across London. But people are gradually, probably it's about 2 a year, get tenancies, and we know there's a block of care leavers. The numbers will be going down as they age, and because the NTS is working, it's not the continual amount. We're not expecting that amount. So actually, almost year by year, by virtue of the numbers going down, it will cease to be a problem. But it is very stressful if you're waiting, and that's how it is, which is why we do the monthly online sessions. I see young people fairly often, and we've also got a no rent, no tenancy policy that we're really shuffling now, so that people are practicing paying their rents better, so that when they get their tenancies, they keep hold of them better. I mean, we keep the social worker all the way through pre-18 all the way through post, so you've got the same person, which is often a challenge for young people in other systems when you've got a stranger. So they're used to us bugging them, but it's very much around waiting is hard. You're in great accommodation whilst you're waiting. They're not in something that's not safe. They're in good quality, high quality accommodation that they're managing, doing their bits and bobs, registered with everything they need to, going about their business, so that they only move once into their permanent tenancies. But waiting is hard, I would say. And 2 a year to a young person sounds wildly unimpressive, but actually across London we're not bad.
I think you've probably answered the question, Rachel, because I was thinking, following from Steve's question, how secure people feel, these young people feel from 18 if they're waiting till they're 25. Okay, a year or 2 years, but even then it can be very stressful if you're not sure where you're going to be permanently. Yes. And that has impact on other decisions that you might want to make.
It does. The joy, I mean, equally, I'm from out of London, so for me I see London, whereas they say specific bits of London. Well, there's only a few estates actually with the city. They're going to be in zone 1 or 2 actually. So if you're in your permanent, we make sure there's very few changes for young people moving. We know that it's not good for the long-term outcomes. It impacts all sorts of things. So whilst they're waiting, they're in, bless you, good quality accommodation that stays for that long course. They've got the relationships that stay. So there's enough scaffolding there, and they know that they're not going to be in a permanent tenancy outside of London, because our estates are only in London. Mm-hmm. So to them it might be a massive deal, Southwark or the City of London, but in practice it's their walk. But then again, that's my older person's view of something. Okay. So they're not going to be, a long way away.
Can I also just then ask a question on the main report, page 26, para 7? You talk about more work to do to promote the role of the IRO and the virtual school. What is that work? And again, how successful do you hope it'll be?
I suppose we've reflected on this. It's very small numbers of children, and I think sometimes what we see in the annual survey is terminology can confuse children. So they might know RIA by name or by face, but don't necessarily know the IRO name, so to speak. However, we're looking at updating our profiles, making sure that profiles go out in the Welcome to Care pack. Same with the virtual school, and just trying to streamline some of the terminology used around that. Children have their reviews on time, get the support they need, but I think sometimes the names of things can be tricky for children to remember. So just being clear that they have RIA's contact details, etc., and can get in touch.
Debbie, your hand's just gone up.
Yeah, just to say that nationally, the DFE are looking at the actual name virtual school. Since the pandemic, virtual has sort of taken on another meaning. Virtual, when the virtual schools first became in existence, was very much about it being an overarching education support system for children who were in the care of the local authority. But actually, since a lot of teaching has gone online, that's considered to be virtual. A lot of people working virtually from home. So they're looking at a new title for virtual schools, but we don't yet have it.
Okay, thanks. Yeah. Any other questions? Oh, yeah. Laurie, were you planning to? No.
I was just going to add though, in terms of the IRO profile, the nature of the work has changed a lot in the last 2 years. So there's of the 15 new arrivals of children in care that we had last reporting year, 13 of them moved within 33 days. So I only ever get to meet them once. And in that first meeting, the one and only meeting I have to explain what an IRO does. I have to explain what a review meeting is. They've got lots of questions about the National Transfer Scheme. They've just met their social worker 2 or 3 times. They've got the new house. So there's a lot of information. So we've looked at a written document that they can hold on to. And we're also going to be doing this video because there is, before we would have longer term relationships with these children and we would know them for 2-3 years and they would know what the IRO service does. But now we get that one shot. So it's how much information can they have in one visit and what can they have instead, just to have the time to process it.
Thank you. Any other comment? No. Okay, shall we move on then, please?
Thank you, Chair. So we turn to item 6, which is the corporate parenting strategy. This is from page 29 in the main report pack, and then the appendices pack. It's in the public pack from 127.
Ellie.
Sorry. Oh yeah, sorry. So yeah, this is the corporate parenting strategy for 2025 to 2028. So it's a new strategy building on what we've had previously. It's a legal requirement to have a corporate parenting strategy, and it's been brought today to Safeguarding Sub for endorsement, and it will go to CCS committee for approval. And we're also looking at taking it to the Court of Common Council to really emphasise and raise awareness of the corporate parenting role of all members and the organisation. So I won't say too much more about the strategy. Happy to take questions. There is a sort of actions throughout the document, and at the end there's some sort of measures we'll be looking at, and we propose that as part of the sort of monitoring process we bring that back to Safeguarding Sub on a quarterly basis. So it's for members' endorsement.
Any comments, Steve or Stuart? No. Okay. Great. Thank you very much.
Save it for CCS.
Yeah, save it for CCS. No, but I think that we in call over we talked about whether it should go to Common Council or not, and I think that it should, because everybody on the Court of Common Council is a corporate parent, and I'm not sure that that role is properly understood by some of our colleagues. So I think even if it won't get a lot of discussion, it's still helpful for that paper to be in the pack so that people can read it should they be interested. So we'll do that. Okay, we can move on then.
Thank you, Chair. So we turn to item 7, which is the City and Hackney Safeguarding Adults Board Annual Report for 24-25. It starts on page 33 in the main reports pack, and it's also in the public appendices pack, starting from page 151. And Claire Solly is online.
Hello, Claire, and welcome. This is, I think, your first meeting with us in City. I wondered, given that as it is your first meeting, whether you just want to say a few words of introduction about yourself and how you see the role, and then the report, of course.
Absolutely. Good morning. Thank you, Chair. Good morning, everyone. My name is Claire Solly. So I'm the new independent chair of the City and Hackney Safeguarding Adults Board, and I commenced in June. So been here for a number of months now. So I am a registered social worker. Before I qualified, I did some work in criminal justice. I've spent approximately 20 years working in local authorities in adult social care with a range of experiences, both frontline, middle management and laterally strategic leadership roles covering quality assurance, safeguarding, deprivation of liberty and practice improvement. So I have a real passion for adult safeguarding, and it's always been something that's front and centre in whatever role I've been in. And I'm also the co-chair of the London Safeguarding Adult Board, which brings together all the safeguarding adult boards in London. So to look at the regional footprint, so how we can support individual safeguarding boards, but also feed up to the national footprint too. So the role, this is my first role as an independent chair. I was a chair of the board in Hillingdon, but it was while I had another role within the council there. So it's my first role as an independent chair. So really grateful for the opportunity and delighted to be in the role. It's a really critical role in terms of the safeguarding adults agenda. So the emphasis is on it being an independent chair, so completely separate from any of the partner agencies and of course our three statutory partners being the local authority, the police and health. I come into this role, my experiences so far have been it's a very well established partnership. There's strong and effective relationships across the multi-agency system. I just want to say thank you to partners for their warm welcome. As part of my induction, I've met a number of people, and also just to thank the previous long-standing chair, Dr. Eddie Cooper, who was very supportive and generous in providing a comprehensive handover to me. The successes of the partnership, I think, are really clearly laid out in the annual report. And it covers the period 24-25, the financial year, and the contributions from partners, not only through the really rich and personalised case studies that are presented, but also the set of data that we have, I think to me just demonstrates the effective and strong partnership across the City of London and also Hackney too. So the successes are achieved through the partnership before I arrived and under the leadership of Dr. Eddie Cooper. So as I say, the report covers the Safeguarding Adults Board period 24-25. As you'll know, the Safeguarding Adults Board is a statutory board with the local authority as the lead agency. Amongst lots of duties, one of the statutory duties is for us to produce an annual report, which is what you see today. This isn't the absolute final version, so it's with the publishers at the moment. So you'll see there are some sections that still need to be added in. They have been and they're with the publishers, and we will have this published hopefully by the end of next week. We're just waiting for those updates to be made. I think really importantly, just to say, the purpose of the Safeguarding Adult Board essentially is to prevent abuse and neglect and to get assurance that the multi-agency systems that you have across the City of London are effective in preventing abuse and neglect, but also ensuring that our responses are timely and effective when concerns do arise. You can see from the data in the report that there has been a slight reduction from 2016-17 in terms of the number of concerns. So when safeguarding went onto a statutory footing, we saw an increase from 2016-17 in the number of concerns that were being raised. However, in City of London, which is against the national trend, there has been a slight decrease in the number of concerns that have been raised since 2020-21 to 49 for the financial period 24-25. Out of those 49 concerns, there were 21 what we call safeguarding adult inquiries complete, And what that means is that the statutory threshold for a safeguarding inquiry was met. The data in relation to the types of concerns that were raised are similar over the past couple of years. So what we can see is that in terms of the number of concerns raised, self-neglect was the highest type of concern at 33%. Neglect and acts of omission was second at 27%. And then financial and physical abuse was third at 14%. When concerns progress to an inquiry, and there's lots of reasons they don't, it could be the adult's wishes, it could be the statutory thresholds not met around care and support needs, but where the inquiries did commence and concluded, the highest types of abuse were neglect at 32%, self-neglect at 29%, and financial abuse at 18%. In terms of making safeguarding personal, so it's really, really important that the board and the activity and partners keeps the wishes of the adult at the centre of everything. Really impressively for City of London, 62% of people were asked, what is it you want to achieve? What is important to you in relation to us supporting you in the context of safeguarding adults? So 62% of people were asked. And then out of that, 69% had their outcomes fully or partially met. So again, really, really impressive in terms of those data sets. The demographics of City of London, so 68% of the concerns related to people where ethnicity was recorded as white. And that is in keeping with the national trends and what the data that we see. A slight difference for City of London is that it's more likely to be men who we receive concerns about, just marginally more likely to be men when nationally it's females. But my understanding is that the population of males is slightly higher in City of London. And again, around about 60% of the concerns relate to adults who are over the age of 65. And again, that is keeping with the national trends as well. Some key areas within the report that I would just like to take the opportunity to highlight. A really strong training offer. So the board provides multi-agency training for partner agencies, and we'd like to retain the ability to do that. So that's a significant achievement for the board. Within this time period, there were 2 safeguarding adult reviews published. So what this means is the statutory threshold for a review is that there are concerns that the way that multi-agency partners have worked together could have been more effective in either preventing serious abuse and neglect of an adult, or the adult has died. So in this time frame, we published 2 discretionary SARs. So what that means is, and I think this demonstrates the healthiness, the reflective and continuous learning culture of the board, is that while the statutory threshold was not met, there was significant enough concern that there was learning to be achieved that they commissioned 2 independent authors to complete safeguarding adult reviews. Now, the themes of those are contained within the reports, but I think it's important to just highlight what those themes were. So the first safeguarding adult review was for a man called JL, and he lived at home and sadly died of self-neglect. A 7-minute briefing is published on the website, and there are a number of improvements. The key issues that were highlighted were in relation to our escalation policy. So really important people know how to escalate emerging or current risks. In strengthening our relationship with housing and housing representation on the Safeguarding Adult Board, and also hospital discharge processes. The gentleman JL was a resident of Hackney. The second Safeguarding Adult Review relates to a gentleman called Steve, and again this gentleman was a resident in Hackney. He was a homeless gentleman and sadly died. The key learnings and improvements were in relation to our multi-agency approach, training in relation to self-neglect, palliative care, the Mental Capacity Act and advocacy, so ensuring that the views and wishes and the voices of people remain front and centre. Moving forward for the board, we continue to review the implementation of the learning and recommendation from SARS. We are relaunching our quality assurance subgroup, so we're starting to include our performance data within that, and our first meeting will take place in November. And what we'll do is we'll test out through a multi-agency audit, which is likely to be focused on self-neglect, the embedding and the impact of the learning and recommendations from safeguarding adult reviews. And we have rewritten, following our away day, which was well attended and engaged from key partners across City of London and Hackney, our 3-year strategy, which will run from April 25 to the end of March 2028. The 6 key objectives are listed within the annual report. Moving forward this year, the final point just to raise for you this morning, with 4 key areas of priority for this year, and those reflect our learning from safeguarding adult reviews, data, feedback from residents, and multi-agency audits. And those are self-neglect, financial abuse, multiple exclusion homelessness, and last but by absolutely no means least is our community engagement strategy. So we're really focusing on those areas for the rest of this financial year, and will likely run into next year. Community engagement's particularly important, and as an independent chair, I've been visiting community organisations and groups. It's absolutely critical we understand that people know what safeguarding adults is, they know how to report concerns, and they understand what will happen if concerns are reported. Now, all of this sits within the context of people being individuals and communities, and this must include seldom heard voices and our harder to reach communities. So we've got our community engagement strategy, which we're finalising and will be published imminently. And what we want to do is build on the networks and the rich volume of different activity that happens across City of London at the moment to help engage with people, share key messages, understand their experiences, understand barriers, support people to feel less socially isolated, and so we can work together as a community to prevent abuse and neglect happening in the first place. So I hope that's helpful. You do have a copy of the report, and our strategies will be published imminently, but I'm happy to take any questions. Thank you.
Thanks very much, Claire. Steve or Stuart, any questions? Steve?
Well, I've got 2 questions, one for Claire and I think one for Chris. So if you'll go for Claire first, I'm glad to see, Claire, that you're saying that one of the strategies is around homelessness. And I suppose I'm interested in where the boundaries are between the work. Maybe this is a question for Chris as well, now I've thought about it, where the boundaries are between the work we're doing with people that are living on the streets, and where there are people living on the streets that are quite clearly very distressed, either through being very addicted to drugs or mental health issues. And I'm just not quite clear where those boundaries are and how we might look at things differently. And certainly there has been around the Barbican area, and I think an increase in the number of people living on the streets that are quite clearly distressed through mental health or drug addiction.
Thank you for the question. So safeguarding and multiple exclusion homelessness is a key area where there's lots of research emerging. The City and Hackney Safeguarding Adult Board, before I joined, have really been pioneers in this area, led by the previous chair, Dr. Adi Cooper, and key partners. And we actually commissioned one of the leading people who are carrying out research in this area, an academic, to look at a number of concerns where people have been rough sleeping or in temporary accommodation or supported accommodation, where they have not had the same access to your point, mental health services or health services, or they have experienced abuse and neglect. So in terms of intersectionality, people who are rough sleeping, living in temporary accommodation, there are particular risks that they experience around inequity, not being able to access services, and how our responses as a multi-agency system with the touch points we have with people need to be most effective as they can when you have those opportunities to engage. So the work plan that the Safeguarding Adult Board is finalising at the moment is how do we make sure the population has access to the support they need at the right time, and our responses are most effective, and our systems and processes do not hinder that, and they enable a timely and effective and coordinated multi-agency approach. And I'm really clear and passionate that action plan and those areas of work must absolutely include the voices of that population, of the people who are rough sleeping and homeless. And we are working with a number of agencies to develop what that will look like at the moment. And so hopefully that helps. Thank you.
Chris?
Yeah, if I can come in as well and just perhaps just give you a bit more specific detail in the context of the City of London and the architecture around those issues. So in terms of multi-agency oversight, we have a number of groups. We have a task and action group. We have a challenge group. These are different types of groups. The challenge group is focusing on the most complex cases, the more entrenched people who have been known to us for a number of, well, certainly months, maybe years. And that's attended by ELFT. So we have what's called a RAMP service, is a mental health practitioner service, and also Turning Point, who are the commissioned service for substance misuse. And also we've got a qualified adult social care lead who works across adult social care and the homelessness team, which is a key bridge, if you like, in terms of the Care Act responsibilities, the safeguarding responsibilities, but also then meeting an immediate need, working in partnership with those colleagues. So that's, if you like, the operational architecture that kind of keeps a focus on that particular cohort. It's worth noting within that context as well is the cross-boundary issues and the people that we are working with. So Turning Point, for example, have a footprint in other local authority areas, and sharing of information through what's called the chain database, which collects the information about people who are on the streets, enables us to share information as well across boundaries where they may not be somebody who would meet our residents with a small r requirements or category, but we would still hold them while they're here and then work alongside other local authorities who would provide similar sort of type of support. So I hope that assists.
Steve, you had a second question?
I do, and this is definitely aimed at Chris. So everybody will know that we are planning a major refurbishment on the Golden Lane estate, and on the Golden Lane estate live a number of vulnerable adults. And I suppose what I'm looking for, both from your colleagues and housing colleagues, is that we are really joined up, because these people will need to be decanted. And I think a number of them may have maybe get quite distressed around that. So I think we need a sort of plan that reduces the distress that they might feel, that you and your team know about who these people are, and that we have strategies in place for helping them when that time comes. So that is a question. It doesn't sound like a question, but it is a question.
Well, I think you're possibly asking me to just offer you an assurance that we will do that, which we will, absolutely. And we would have that intelligence anyway. I think what would maybe more interesting for us to delve into is those individuals who perhaps at the moment are below the threshold for statutory adult social care services, for example, that we might not know at the moment, but we would expect our colleagues at Golden Lane, the estate team, to know. And certainly we work very closely with them across children and adults vulnerability anyway. So I can offer with some degree of confidence that information sharing and partnership working internally will be happening as part of that plan. And I think when that plan is presented, maybe we should have a very specific focus on vulnerability within it, so members are assured of that.
Thank you. I mean, from my perspective, I don't know if this is where Steve was going, but I think for every vulnerable person on the estate, they need a personal plan to support the decanting process. And the sooner we start putting that in place, the better, because time passes very quickly and we'll be decanting people in, I don't know, 18 months or so, and that's going to need a lot of careful planning, isn't it?
No, absolutely, and I can say that we have conversations. For example, Black Raven Court. I'll appreciate the issues that are associated with that. Conversations have been happening for some time about identification of vulnerability within that plan. So yeah, that will be happening.
Right. Stuart.
I have a question for Claire. Claire, you mentioned touch points. With homeless people, by the very nature of their particular circumstances, what are the touch points with a homeless person? How do they actually get in touch, or how do we know their circumstances and how to improve them?
Thank you. So there are a number of touch points, and through a safeguarding adults lens, and it's within our strategy, is safeguarding is everybody's responsibility. So I think that's always the starting point. So the touch points for people, we would want the touch points to be access to GPs. So it may be that they're accessing GPs. It may be that they have support through homelessness services, rough sleeping, in terms of outreach work. It may be that they either have outreach support or are visiting themselves homelessness support services, so around accessing food, drink, shelter, or health services. And so there's a number of different activities and touch points that we can have. What we don't want is for those touch points to be at the point of an escalation. So either through A&E or through contact, well, it could be a positive contact with the police, the City of London Police, if they're offering, signposting, advice and guidance to people. But obviously there will be other touch points where matters escalate. So this is the whole multi-agency partnership that we absolutely need to be clear. Every contact with somebody counts, and part of the action plan is equipping people with the right skills and knowledge to be able to offer that signposting, advice and guidance, link people into services. And obviously from a systemic perspective, we need to make sure that those pathways and referrals and people are in the right places. And to Chris's point, there's a really, really strong multi-agency architecture in the City of London at the moment. So there are different touch points, there are different points of escalation, and we want to get to the preventative space so that things are not escalating forward. There are a number of referral routes that come in, so you'll know the City of London Police will send referrals in if they're concerned about people. A number of outreach projects who will send safeguarding referrals in, or referrals where they think people need to access different services, etc. So it's about building on what's already there, and it's not unique to City of London that this particular part of our communities and population, there's still a huge amount of inequality in accessing those services.
Great, thank you very much, Claire. This is for information, so we don't have to take any further action, but I think, can we move on then to the next item, Town Clerk?
Thank you, Chair. So we move on to item 8, which is families in the city, and this is starting from page 37 of the main report pack, and there is also an appendix here on page 203 to 4 in the appendices pack.
Rachel, I think it's just a short introduction on this one, really, isn't it?
Yeah, so Families in the City brings together the social care reforms and the family hub reforms at the same time. We're progressing well at pace. We'll look at the data and usage and feedback formally at Children and Community Services in March. It's beginning stages at the moment with the shifts at the moment. Things happening this week, for example, a sensory room is opening at Smithfield Nursery, so that's exciting stuff. But we will provide a full update in March on how things have gone. We're continuing to do publicity through a whole range of different methods at the moment to make sure that all families are aware, and hopefully the service is a stronger, broader, better offer that people will enjoy. But we'll look at the impact further on in March.
Thanks very much, Rachel. Any questions? No. No, great. Thank you very much, Rachel. It's good to see that it's moving on. Thank you. Next item.
Thank you, Chair. So we turn to item 9, which is the Adult Social Care Safeguarding Performance Report for Q1 25-26. And Appendix 1 is non-public and can be found in the non-public appendix pack on page 29. And the main report can be found on page 47 of the main reports pack.
Thank you. I think, Gonzalo, this is yours, and welcome to your first meeting with us.
Thank you. Yes, hi, my name is Gonzalo. I've been working in the City of London for 2 years, and I'm going to present the Adult Social Care Safeguarding Performance Report for this quarter, 2025 to 2026, from April to June. So, like, this is the Adult Social Care Service at the City of London Corporation provides a range of services that includes like safeguarding and the safeguarding performance dashboard that we have shown and is non-public for this quarter. Shows that overall the performance across the service is good. We are meeting all our range of statutory requirements and local targets. As Claire mentioned at the like two sections before my presentation, we can see like the national trend regarding concerns and an increase in England is increasing. For the City of London has been gradually decreasing in the last years. And however, it's important to notice that for this quarter we have a higher numbers than usual. So we are projecting, or we are estimating that this year we will have an increase of the numbers of concerns and increase in the City of London. And it's also like the patterns that Claire also mentions are basically the same. The most common type of abuse is self-neglect, neglect and acts of omission. The majority of cases regarding concerns and inquiry are men and older than 65 years old. And as the previous year, for this quarter, of course, we cannot make a conclusion for the whole year, but for this quarter, 67% of our increase, they fully or partially meet their expected outcome. So that's a trend that is been the same for the last years, and it's continued to follow that way. Apart from that, if you have any question on any particular commentary, I'm happy to answer that.
Thank you very much. Any questions, Steve or Stuart? No, I have none either. So we'll move on then to the next item, which I think is also you.
Thank you, Chair. As I turn to item 10, which is the Children and Family Service Performance again for Q1. Again, there is a non-public appendix to this one, and the main report starts on page 49 of the main reports pack.
Yeah, it's me again. I'm going to present the children performance report for the quarter as well, from April to June of this year. So the report also includes like 6 data points that it's important to highlight. First of all, the demand remains high in our children's social services, but there is a gradual year-on-year decline. In the first 3 months, we have 166 contacts, and if that trend continues for the following quarters, we will expect a little number lower than the previous 2 years in terms of contacts. Regarding the number of children in need, it has increased from 6 in April 2025 to 14 at the end of June. We have been talking about that also, like the children in care in the City of London has increased from 4 in April to 6 at the end of June. We have, of course, more actual numbers that we have discussed at the beginning of the meeting. The 4th point is that multi-agency safeguarding hub, the MASH, recorded 1 contact in the first 3 months, which is 1% of the referrals. it is estimated that the total number of the MASH contacts for this year will be lower than the previous one, which was 16. There were 2 early help referrals in the first quarter, and it is estimated that also that number will be lower for compared to the previous year, where we have 24. 100% of our assessments this quarter were completed within the 45 days, which is a significant improvement from the last 2 years. And regarding the caregivers, at the end of June 2025, we had 48 in the corporation, and that's also a decrease from the numbers that we have in March of 2025 and March of last year. So yeah, that will be all. And in case you have any question or commentary, I'm happy also to answer them.
Any questions? No? Okay, thank you very much,
Thank you.
Zala. We'll move on.
Thank you, Chair. So we now turn to item 12, which is the Special Educational Needs and Disability Update Report. And this is from...
I think we've missed item 11.
Oh, we have. Apologies. I might be fired. Here we go. Item 11. We have the Draft Children and Family Service Staff Evaluation 2025, and that's starting from page 53 from the main reports pack and 75 from the non-public appendices pack.
Rachel?
It's me again. This is a normal self-evaluation that we do each year to look at our progress, what we're doing, what we need to improve, what we have, how we have improved, and what we're doing next. You'll see that numbers have declined in that case, but our long-term child in need offer, which is for children with disabilities, is done through short breaks, and that's something we've really focused on this last year, something we're really proud of, and the families feedback on well. So instead of holding children as children in need, we're holding them with short breaks, which means we're giving them lots of intervention without lots of assessment, which is welcome. Family feedback has been good on the range of short breaks, and also we've had a summer holiday and Easter holiday programme for families, which has been really good piece of community social work practice. Families trust us to look after their children. Our social workers and early help workers are running around giving one-to-one support for kids with disabilities, which means families can see that we're good at looking after kids, and we can spot needs and identify them early. So we're really proud of that piece of work. We're proud of the whole piece of work, but the holiday programme has been a really good programme with the virtual school head and early help in particular, and has been something we're really pleased to offer as well. But it is a comprehensive assessment of our whole service. Most of our work is unaccompanied asylum seekers and children with disabilities in the city, and there's some other stuff as well, but we're really proud of it. We've talked a bit about housing, so I was going to do that now. I'm not going to now because you've already heard it. But the other piece of work is improving is our education, training and employment for care leavers, which is continually a challenge when you've got a need to work and provide for your families back home potentially, as well as engage in education so that you could earn more money in the future. But it's a comprehensive review of our really very, very strong service offer for 0 to 25s in the city.
Thank you. Any questions for public? No? Okay, thank you very much, Rachel. We'll move on.
Thank you, Christine. Now we actually do turn to the Special Educational Needs and Disability Update Reports, and this is from information starting on page 57.
Thank you, Chair. So this report was written and submitted prior to the City of London's call for inspection, which we received on the 15th of September. The area send inspection has taken place and we received positive feedback, but there isn't anything I can further disclose at this time. However, once we get the report, we will do a full report to members on the information that we can disclose, and including any recommendations. So if anybody's got any questions, there are also, if there's extra information in that report about the work we've been doing over the past year to increase our positive experiences for our families. So if anybody's got any questions, then I can answer them.
Any questions? Item 12? No. Thank you very much. Move on.
Thank you, Chair. So we turn to item 13, which is the Virtual School Annual Report 2024 to 25. This is from page 63 in the main reports pack and is found in the non-public appendices pack from page 153.
Debbie, over to you.
Hello, thank you. So members will probably be quite interested to see the wide range of courses that our young people actually study, right the way from early years in school, right the way up to GCSE, and then a huge range of courses from security courses into plumbing, into nursing courses, and then into universities, a very, very wide range. As Rachel was saying, some of our young people have the challenge of earning money and also studying. But I find that the majority of our young people, they do that very well. They do take on work as well as studying, particularly in English, because they really want to get their English levels up, which is really good. We have some very good systems in place now to capture any children who are not in employment, education or training. And Rachel and I meet regularly to make sure that we've got as many young people as possible actually in training, in education. There's a rising interest in apprenticeships among our young people. They see that as a much more flexible option. Sometimes they get the chance to earn money at the same time as studying, which is really good. And so a lot of our young people are interested in that. We've been working very much across Pan London with the other virtual schools. I'm currently joint chair for the Pan London virtual schools this year. And many of our young people are placed in colleges and in residential accommodation, which is not necessarily in the City of London. So it's really important that I'm aware of all the offers that are available for them where they live. So it's really important that we work together. I think the report highlights that we work very much in partnership with other teams across the City of London and across Pan London as well. We particularly work very well with the Education, Adult and Skills team. They're very flexible about when we can have admissions. So if a young person is not successful at a particular course midway through the year, they're really flexible about us enrolling our young people with them. Also, if young people arrive into the UK, they're very flexible about taking young people at different times of the year, which is good. We've had some successful training over last year and into this year as well. We actually held our most recent online training, and over 100 teachers from different schools across the city and across Pan London as well attended. And that training was very much focused on how to support children in schools and colleges who have experienced any form of trauma. And there's a growing interest, I think, across schools about how they can support these young people and prevent exclusion from school, which is really heartening for me. Some exciting work took place last year with some of our children who used to have social workers in the past. Virtual schools now have an extended remit to make sure that we're available for those children if they or their families come back to and want support. So we've been helping a number of those young people with their GCSE revision and also with their university applications and getting into university. The Department for Education and Ofsted are all reporting that the extended duties are making a real difference to groups of young people who do still need some extra support with their education. So the actual report, because there's photographs in it and because our small numbers in our cohorts may identify young people, that's in the non-public.
Thanks very much, Debbie. Steve or Stuart, do you have questions? Debbie, I have a question which is about apprenticeships, which increasingly I think is becoming important for young people as an alternative to further education of these days. And I just wonder, I've heard a lot of comment about how much or how not much the city is doing around the offer of apprenticeships. Do you have a view about whether we have a good enough or well enough coordinated approach to this? and whether there is more that we should be doing both internally in the City of London Corporation, but also working with other bodies in the city to try to secure more apprenticeships.
Yes, in fact, Chris and I have got another meeting this week to talk about that with Melody Thornton. Melody is really good at pushing apprenticeships and the opportunities for apprenticeships in the city. It's about making sure that we've got all the systems in place to support officers who are taking on apprentices, and also that the apprentices get a really, really good deal when they're actually working with us. So I think we've work to do. I think we've got some big successes so far with apprentices that the city have taken on, but I think there's still work to do around putting those systems in place, and Chris and I are working on that at the moment.
Chris, sorry, could you tell us who Melody Thornton is as well, please, where she fits in this?
Melody runs the apprenticeship team for the City of London.
Thank you.
And I mean, and just to add, Debbie has actually herself has currently has got 3 apprentices within the virtual school arrangement, which is great. And again, you know, relatively speaking, the size of the virtual school and being able to take on 3 apprentices has been great. Actually took on 4, but currently now has 3. But it's really positive work that's been happening. Really good feedback, and pathways for those 3 individuals are great. One of them is actually a care leaver here in the City of London, who's doing really well.
Thanks. Any other, Steve?
Thanks, Joe. Well, I've now thought of a question. Well, I haven't thought of it. I've just been rereading this thing. So it's quite interesting that the number of people that are doing this level 2 award in private security, it seems to be a large number of your people doing this. So I'm just wondering how that has happened, why there's so many, and then also maybe you want to make a comment on NEET, because there is quite a high number of young people that you're saying are NEET.
Yeah, well, it's up to 20% of our care leavers have actually got these qualifications in security. We found that those courses are the most flexible when you're at college, and they also get the opportunity to watch games at Wembley and also and Arsenal, and it really fits in with their lifestyles of wanting to do some work so that they can earn some extra money, but also go to college during the week. So a number of our young people have asked to go on those courses because it also gives them an opportunity, as I say, to watch Robbie Williams or whoever else they want to watch too, which is good. Also, with our NEET, we have 2 different types of young people who are NEET, really. We tend to have a small group of young people who are what we call long-term NEET, so that's more than 12 weeks, and we've got action plans for those, and we're trying to support them back into college. It could be because of poor health or a range of reasons, but we tend to have some young people who are NEET for a very short period of time where the course hasn't worked out well, or the course has come to an end, or their job has come to an end, and then they're wanting support to get back into work and back into college. So we do a lot of work with young people where they're NEET for possibly 2 or 3 weeks or even up to a month, but then we've got a very small group of young people who Rachel and I work very closely with to try to engage them back into the learning process.
Good. Thank you. I think I might have a job myself. I'm just reading these again. Thank you. Any other questions? No. Okay. Well, thank you very much indeed, Debbie. Thank you.
Okay.
Thank you, Chair. So we turn to item 14, which is the City and Hackney Safeguarding Children Partnership annual report for 24-25. This is on page 67 of the main reports pack and from 209 on the public appendices pack.
Thank you. And unfortunately, Rory McCallum has been called away between call over and this meeting starting. So he sent the words that he wanted to share with us to Chris, who's going to read it out on his behalf. And I'm sure Chris will try his best to take questions if we can. Thank you.
And I will read exactly what he said. So these are his words, not mine. So the Safeguarding Children Partnerships Independent Safeguarding Children Commissioner has provided his overview and independent evaluation of performance across the partnership's footprint in the City of London, which demonstrates strong performance, stability and continued improvement across key safeguarding areas. Outstanding Ofsted rating for children's services in 2024. 3 of the 4 reviewed areas were also rated outstanding and the 4th was rated good, with inspectors noting that services make a significant difference to their lives. There's effective early help and the care leaver offer, with strong early help offer contributing to a decrease in children in need numbers. The independent annual feedback surveys reported 100% satisfaction rate for early help, and a well-developed care leaver offer was launched, including monthly online drop-in sessions. Stable children's workforce remains stable with a permanent team in place, and staff have completed significant training, including achieving best evidence and systemic training. Police safeguarding enhancements. The City of London Police's Public Protection Unit was strengthened with the recruitment of an experienced child protection detective inspector and the creation of a new detective sergeant post. The force also conducted Operation Make Safe deployments to test and educate hotels on the response to possible child sexual exploitation. An appeal inspection, which was recently published, identified 2 outstanding gradings. The executive was recently reassured that the areas for improvement are in focus, been undertaken. And overall positive governance, strong leadership and no serious incident notifications. Areas of focus, whilst performance was high, data and priorities highlight the following areas for continued focus. Increase in LADO service contacts. The LADO received 122 contacts with a 65% increase from the previous year, which aligns with London and national trends. And I'll add to this that actually Laura's LADO annual report did come to the last meeting of this subcommittee, so the details of that have been covered there. Rory also mentioned about the ongoing training for the LADO, which are making concerted efforts to reach out to religious institutions to raise awareness, which again is part of the work that the LADO is offering. Statutory assessment completion time, we picked this up in Gonzalo's report. So Rory and Jim identifying that last year there was 63% of assessments completed within 45-day target, and obviously we were pleased to see today that that's actually at 100% now. So it's worth noting the small numbers that have impacted on that figure, and that was 1 family last year, but nevertheless the partnership identified that as an area to focus on. And then overall, the broader safeguarding partnership priorities which the City of London must address include the following 6: health and stability of workforce, active anti-racist practice, the voice of children and young people, maintaining and building on the foundations of good practice, strategic vulnerabilities and pathways to harm, and an appetite to learn. Thank you.
Thanks very much, Chris. Any questions? No. Okay, thank you very much then. And
Yeah, just to note, and that is going to come to CCS as well for information.
yeah, thanks.
Chair, we turn to item 15, which are the questions. I have received none in advance. And seeing none now, we turn to item 16, which is any other business, which is none has been notified. Again, seeing nothing, we turn to item 17, which is the exclusion of the public. So I'm going to ask, are members content to exclude the public for the remaining items of business at this juncture?
Yeah.
Thank you. There'll be a short pause whilst we just end the live stream.